Hello and welcome to the Birth and Baby Talk show. I am Leanne Palmerston from Hamilton Family Doulas, and I'm one of your hosts here. And this week we have a very special guest with us, Dr. Courtney Werner. Courtney is a chiropractor in the Ottawa area, and she's also the mom of a baby who, while she was pregnant, she received a diagnosis that her baby was going to be needing some special care after birth. And today we're going to be talking about that experience. And, because not everybody has a straightforward pregnancy and new parenting experience. So welcome, Courtney.
Thank you. And my daughter Cecilia is here with us, and we're starting off this podcast by me changing a diaper.
Oh, awesome. Well, we're all moms and we've all got to get it done.
So, yes, I'm a chiropractor in the Ottawa area, and I primarily see a perinatal population. So I am super familiar with seeing all the wonderful changes that a mom's body goes through during the pregnancy and after. And when I got pregnant with my daughter, I thought to myself, well, I'm young and healthy, and there's no reason I'm not going to have a perfectly average, healthy, normal pregnancy. And I never in a million years, I think, as most moms that find themselves in my situation, never thought that this is where we would be, or these are things that we would have to think about.
Yes. I think most of us, you pee on a stick, or you start to notice the undeniable symptoms of pregnancy, and then you start thinking about, well, your beautiful bump, and then a beautiful birth, and then you have these beautiful visions of what it'll be like to maybe sit and feed your baby late at night in the quiet, or cuddle them and go for hikes and things. But your experience ended up being a little different than that.
So I started out with a midwife, and I had planned to have my daughter at the Ottawa Birth Center. So I had a very kind of like holistic, lovely view of how this would go, with minimal intervention and minimal people present. And fast forward to when I had my daughter, there was like 20 people in the room, and It was a whole circus. But we will get there. So I think, like many moms that find out that there is something atypical about their pregnancy, I found out at my 18-week morphology scan. And my midwife, who was awesome, I was getting very excited because I wanted to know the gender so badly. I can't wait. I couldn't wait. I was so sure it was a girl, and I needed confirmation. And she was like, well, hold on. This is also the morphology scan. They're not just looking for those fun things. They're looking for, the growth and development of the baby. And in my head, I was like, yeah, it's fine. Everything's fine. So at that 18-week scan, we found out that my daughter's limbs, her arms and legs, were measuring behind.
Yeah.
So she was at 18 weeks, but her limbs were about 14 weeks. So like quite significant, about a month behind where they should be.
Yeah.
So at that point and that can be nothing. It can just be, mismeasurement. It can be your baby's a little smaller than they expected. But it can also be, so she had some bowing in her lower legs. It can be soft markers for Down syndrome. And it can be, you okay, honey? Yeah. It can be hard markers for things like skeletal dysplasia or dwarfisms.
Okay.
So I was sent at that point, which is pretty typical. So my midwife sent me to a maternal fetal medicine specialist for a follow-up, level 2 ultrasound. And at that point, we were given some very devastating news. And that was that the first maternal fetal medicine specialist that we saw said that our daughter would have a lethal diagnosis, and she would not be able to survive outside of pregnancy. So this is why I like to talk about this, and why I like to share my experience, because at that point I was counseled to terminate the pregnancy, which is, obviously not something someone wants to hear when it's a wanted and a pregnancy they're very excited about.
Yeah.
Oh, okay, you dropped your cookie.
Yeah, Cecilia agrees.
Yes. And you know what? No judgment for parents who, are faced with that choice, because there's no easy or right answer. It's just what's right for your family. But I luckily was able to get in touch with a genetic counselor, another maternal fetal medicine specialist for a second opinion, as well as hi, honey. I know. A perinatal hospice, which is in Ottawa. It's at Roger Nielsen House, but every major children's hospital has one associated with them. I know. She's staying up because she knows she should be napping and she wants to be part of the party.
She does.
So kind of from that point on, it was not the pregnancy that I had expected. And I know many, many moms that I've been in contact with since that have gone through the same thing. So it was then level 2 ultrasounds every 2 weeks, lots of medical monitoring. The idea of me laboring at home and having a baby at the birth center was out the window. We had to be at kind of the highest level hospital. And my daughter, we knew if she survived that she would go directly to the children's hospital next door. And in our case, she came out much, much, much better than anticipated, and much better than everyone had expected. So her chest was small, so they didn't think her lungs would be developed enough to breathe, but she came out screaming like she does to this day. So the first thing I heard when I had her was, well, if she's screaming, she's breathing. And that's true. So we have kind of started on this this journey into being not just a mother, but a mother of a medically fragile child, which has been both very scary at times, and I think just as rewarding as any other parenting experience at the same time.
Yeah. I mean, because you still do, you have all the extra stuff that you have to keep in mind, but you are still raising a kid. And it goes through developmental stages, just like every other baby. Are likely a little different, but yeah, you're still going through all the same stuff plus everything else.
I would say the day-to-day kind of frustrations are the same frustrations as every parent has. It's not wanting to take her a nap on time, or getting overtired, or being constipated, or all those lovely things that as new parents we obsess about. They're the same things that on a day-to-day basis are our biggest concerns. But you're right, there is kind of extra involved. So I'd like to speak a bit about having a baby in the NICU, because a lot of parents, even with perfectly healthy babies that end up being premature, end up with children in the NICU. And I think it's not what we expect, right? We expect to have a baby and be able to go home. If you're, having a baby in a hospital, you stay for a couple days. If you have a baby with a midwife at the birthing center, I was expecting to be home in like 6 hours. So it's different than expected. And I would really like to encourage anyone who has a baby in the NICU, or has had and needs the support, that the incidence of postpartum depression and PTSD are very high in that population. It's a very stressful time. I know Cece agrees. It's stressful for her too. That you access mental health resources and reach out to your community. There's no shame in needing help during a very difficult time.
I can only imagine that mental health support is really vital right from the moment you're getting your diagnosis, or everyone is starting to realize that there may be cause for a little extra concern, that there's some anomalies going on that need exploring. And at that point, absolutely, families should be reaching out so that they can start creating a support network for themselves.
So we were lucky enough to be under the care of Roger Nielsen House, and my daughter still is as a palliative care patient. Hi, honey. But I would say that's so vital because, I mean, even if you have a diagnosis for your child that isn't a lethal diagnosis, it's something survivable, but that will have, effects on their life. So her arm is broken, so it's under her shirt here.
Yeah.
She's not missing a limb, but so even things in your pregnancy like amniotic banding or limb differences, those things affect your child's life, even if it seems like it's in a somewhat small way in some cases. There, no matter how well your baby does or how good the outcomes are, there is a grief associated with knowing that your child's life will not be as easy as you hoped. Every parent wants their child to have as easy and happy a life as possible. And knowing that there are any kind of bumps on the road to having that life is very challenging. And it's a kind of loss, even when you have good outcomes for your child and you don't lose that child. It's still something that takes some getting used to. And that's where the mental health help is such a key point, because, what I thought of, as raising a child and what we would be doing together and how it would go is not how it is, but it doesn't mean that there's not a lot of joy here. It just means for us that, she's 11 months old and we're not, waiting for a walking milestone. We're waiting for other milestones. So you just have to kind of adjust your expectations, but it does take time. It's not automatic that, the baby gets here and is healthier than expected. So now what? There are still things to manage at that point.
Yeah.
I know, honey. You want to see?
Hi. Hey, Cecilia.
She's so sleepy. Yes.
Yeah.
Cecilia, just explaining her arm here. Cecilia has a condition called osteogenesis imperfecta, which is brittle bone disease, and in her case is also a type of dwarfism. So hence the broken bones and the helmet and all that stuff. But intellectually, she has normal development. But physically, that's nice. Thank you, honey. She lags behind on the gross motor development. And often it's because, just as she starts to get moving and try new things, she has a broken bone. So it sets her back. So, that's very challenging. But every parent with a disabled child has different challenges.
Yeah.
You just kind of learn what their goals will be.
Yeah, for sure. And I can only imagine the sort of, so all parents live with a sort of ongoing level of stress as they manage, the normal day-to-day raising of a child. But then when you have a child with some exceptionalities, like Cecilia has, or another child might have, every time Cecilia injures herself through, and through doing such normal things that other children would never injure them. But because Cecilia has this particular condition, that it's gotta suck. Like, that's such an extra level of stress on top of everything else, that you're sort of dealing with a lot of tiny heartbreaks along the way as you have to witness what she lives through and help her through that experience.
I think for every medical parent, it's, whatever the condition is, it's very similar. I mean, especially when they're young and don't understand why they're being poked or prodded, it's hard to watch them go through that. But at the same time, it is for their own good and for their health. As she gets older, she will either hopefully be able to recognize that this is for her health, or she'll fight me harder. So we will see as time goes on. I mean, I will say sometimes it sucks. And sometimes, scrolling through social media and seeing my, friends and people I follow with children around the same age doing very different things than we're doing, that kind of stings for a minute, but we have our own joy. And there's always silver linings, and there's always, upsides to every kid. Like, my daughter has a lot of medical needs, but she's been sleeping through the night since like 4 months. So I have friends yeah, totally typical kids that I think on a day-to-day basis have a much rougher start to the day than we do. So, it's all relative, right? There's no comparison. Everyone's parenting journey is hard in their own way, and easy in their own ways. Hi, hun. So you just kind of, I think, take it one piece at a time and try and deal with, each day at a time. And overall, we have a lot more good days than we have bad days. Just the bad days are, yeah, they suck. But
Yeah.
overall, she's a doll. Yeah.
She's so wired right now, isn't she?
She's ready. Yeah, she's ready. She's like, what nap? We're not doing that.
Yeah. um, so when you got your diagnosis, you were saying that initially they thought other things were going on and that you went and got a second opinion.
So can I put you down, Cece? Will you allow? We'll see. Yeah. So initially, and this is very, very common, I think. I've talked to lots of moms who have children with, I know, with dysplasias. Often the first thing that they go to, if it doesn't look like achondroplasia, which is the most common type of dwarfism, the next kind of, when you start going into the other common things, a lot of them have poor outcomes, or historically have had poor outcomes without medical intervention.
Okay.
And in Cecilia's case, she has a severe form of osteogenesis imperfecta. And if she was born when I was born and had the difficulty she did at birth, she may not have survived. But now it's a very different picture, because in the last 20 years, there's been, I'm older than 20, but in the last 20 years in particular, there's been a huge kind of leap in medical knowledge for these kids, and drugs that have been developed to help them. So, they're getting better at giving breathing support to really tiny babies than they were in the 80s when I was born, right? So things have really come a long way. So I would say when you talk to the OB side versus when you're talking to the NICU teams, you get a very different picture of what the possibilities for these children are. Because remembering that once that cord is cut, they're no longer the OB's patient. They're then transferred to the neonatologist care. So the neonatologists, the NICU teams, are the ones that see how these children actually do at this point, and what they're capable of, and what their stays look like, and when they go home. From the OB's perspective, and I'm not knocking OB care. Obviously, it was very, very important in my pregnancy, and we had great care. But they're coming at it from a different perspective, and that's what is best for the mother and her health. In a lot of ways, when they don't think you're going to have good outcomes with the child. So I've seen this myself, and other moms have seen this, where they kind of switch gears from, okay, what is best for mom and baby, to, if we don't expect the baby to have good outcomes, what is best for mom? How can we best protect her and her health? Yeah. So I encourage moms to get that consult with the NICU team, get a consult with a genetic counselor. If you need to, get a second opinion from another maternal fetal medicine specialist, because when you're getting these diagnoses, the decisions that you make for your child are literally life and death decisions, and you want as much information. There's no shame to accessing information. It's not a slight to your OB if you want to have another opinion. Maybe you've already had a baby or two with the same OB and you trust them and you love them. That's great, but you can still get another opinion, and just kind of see what the doctors are saying for your child. So in our case, because Cece was given a presumed lethal diagnosis, we then had to make the choices of what kind of care she would have at birth. Okay. So if you're ever in this position, the options that you have are doing comfort care, which are um, allowing for natural passing, memory making time, and keeping the child as comfortable as possible in the time that they're on this planet, or full intervention, which is, the whole, um, whatever level of intervention you decide to allow for your child.
Mhm.
And I think at first my thought process was, well, if we might not have a good outcome, I want as much time as possible.
Yeah.
However, dealing with the perinatal hospice, we were educated on the fact that it's not memory making and meeting your baby or fighting for survival. Those things can go hand in hand. You can make a birth plan that encompasses as much or as little kind of your personal wishes as possible. So I know things probably are a little trickier with COVID 19 than they were when I had my daughter, but um, there are ways to kind of in, have as enjoyable experience as possible of
Yeah.
that pregnancy and the new baby, and still leave room to kind of fight for their survival if that's what you choose.
Yeah. Yeah, that makes a lot of sense. And do you find that when you worked with, I guess, the perinatal hospice team, they were key in leading you through that process?
Mm-hmm. So um, it was actually, I was very, very lucky that my midwife stayed involved in my pregnancy through the entire pregnancy. Even though she wasn't able to deliver my baby, she was still going to kind of take on like a doula role and be present for us. And she's the one that actually made the referral to the perinatal
Mhm.
hospice. So even though I had a great OB and great OB care, that referral for that extra help came from my midwife, who was actually kind of disengaging in some of that um, more core care, I would say, in my
Yeah.
pregnancy. So I think sometimes it's something that either, maybe the OB doesn't have a lot of experience with, or doesn't know what the resources are, or, just slips their mind that they think you've already been connected and you haven't. So it's definitely worth, if you're in a situation where you have a difficult diagnosis for your child during your pregnancy, to try and make that connection with the perinatal hospice. They help. Um, they have mental health support, but it's also doctors and nurses that are familiar with this, so they'll help you kind of craft a birth plan that makes sense for your child and your situation and your wishes for your child.
Well, that's good. I'm glad that that exists then. And it does highlight the fact that I think a lot of people, like in the entire pregnancy spectrum of expectations and outcomes, I think a lot of us think that when we have a midwife or we have an OB, they're going to know all the things and tell us all the things and give us all the resources so that we can, like a smorgasbord of options that we can examine and choose from, when they really are, they kind of stay in their own lane for the most part. They often do have resources. I certainly don't want to throw them under the bus or anything, but they are kind of, they are focused on what is in their particular scope, and they're looking forward on those kinds of issues, like looking for like how the birth itself will play out from like a medical support perspective, as opposed to how you are going to negotiate emotionally and as a family with potential long-term consequences, those moments for yourselves.
Of course.
Yeah.
um, and I will say, I ended up being transferred to another maternal fetal medicine specialist because I had to change hospitals.
Mm.
And my specialist was awesome. But even as she said, most moms that are ending up with a maternal fetal medicine specialist, it's often because of, the health, their personal health, the health of the mother, not necessarily the child, right? It's much more typical that you're dealing with a mom who has gestational diabetes, or is having blood pressure issues, or has maybe had
Multiples or
exactly. So often that's kind of what, like, they are great at that, and that is what they're used to seeing. And when you're seeing kind of babies that have these more rare diseases, or are kind of on the exceptional spectrum, that's not what they see every day. I know a child like my daughter, maybe that OB will have a couple like her in her career, right? It's not
yeah.
It's not something that they deal with all the time. Whereas when you're talking to perinatal hospice or palliative care, they're used to seeing children that have these needs, and they are, familiar with how these stories go. I will say, you know, hospice is a scary thing when you're pregnant or when you're dealing with children in general,
Yeah.
and we tend to have very negative connotations. But um, it, there's lots of children that really really benefit from this care, whether it ends up being end of life care or they graduate out of the program because they're doing too well, which does happen. So it's a scary word in some ways, but when you actually need to access those resources, they are exactly what you need, exactly when you need it, and they are the kindest, most empathetic people that you'll come across. And we've been, very blessed that they were involved in my daughter's care and continue to be.
So they're a bit like doulas for exceptional parenting journeys.
Hmm.
That's
And
amazing.
I think even if you're having an exceptional parenting journey, you still get your doula, like still get your support people. I mean, I was very lucky to have the support that I did. I had, you know, even though my daughter was never able to breastfeed, I was pumping and she was tube fed. Um, you know, I still had a lactation consultant that I talked to and really supported me through my pumping journey, which I hated, but was really, really glad that I was able to do that for my daughter and to get that support. So yeah, there was some parts of my pregnancy and my daughter's, early life that were, very different, but um, you can still access those typical resources. Like you still have need for those just because your baby's maybe in the NICU or in the hospital for a longer time doesn't mean that you don't need support for your own postpartum healing or lactation journey or whatever it may be.
Yeah, absolutely. Very good point. Well, I don't want to keep you because I know Cecilia needs to settle down and have her nap.
She's sleeping right now. Just
Is she?
she's
Amazing. She's
nodding
just
off. Yeah.
drifting.
Yeah.
Good. All right. Well, we can drift out to ourselves. I want to thank you so much, Courtney, for sharing your story and sharing a little bit about Cecilia and helping us understand that not all pregnancies are going to result in, a stock photo image family parenting experience and what that can look like and what we need to think about. So we need to remember to advocate for ourselves as parents who get these diagnoses, to look for second opinions potentially to confirm those diagnoses and to make sure that you're getting all the resources you can access, uh, especially for mental sort of and like social, that idea of social work and kind of support around the experience.
Yeah,
So
absolutely.
thank you very much. And thanks everyone for joining us for this. If you have any questions, please leave them in the comments and we'll make sure that we pass them along to Courtney to answer or answer the ones that are appropriate for us to answer. And if you come back next week, we will be talking about finding a therapist, a perinatal therapist. So I think that's a good link from this week to next week. And we will be sharing some resources for families that may be helpful in this week's printable in our newsletter. So if you do not subscribe to our newsletter, please get subscribed to that. That'll be going out tomorrow morning. So thanks, everyone. And we hope you have a wonderful week.
Thank you.